The CN Tower illuminated in green overnight in honor of World Kidney Cancer Day. In Canada, it is the 10th most common type of cancer. The Canadian Cancer Society estimating that more than 9,000 people were diagnosed just last year. And with more on this, we're joined by Christine Collins of Kidney Cancer Canada and Dr. Keith Lawson, a urologic surgeon and scientist at the Princess Margaret Cancer Centre. Thank you to you both for joining and speaking about this very important topic, and I'm glad we can put a spotlight on it. I want to begin with you, Doctor. For those who might not be aware about kidney cancer and now learning these stats, the 10th most common, what is it that you want viewers to know about it?
Right. So first of all, thank you for allowing us to be here and shed some spotlight on this disease. It's very important to us, and of course it should be very important to our viewers, of course. I think one of the most important things patients should be aware of is there are some symptoms that can reflect kidney cancer. So if they have any blood in their urine, this is something that they should always take seriously and get evaluated by their doctor. They should be very aware of their family history. If there's a history of cancer, specifically kidney cancer that runs in the family, this is something they should be aware about and seek, opportunities to get testing for kidney cancer in that context. And so, those are the I think, most common ways that patients could present with this disease. But we have to also know that most patients will not have any symptoms. The most common way kidney cancer actually presents these days is folks go for an ultrasound from their family doctor because they've got some abdominal bloating or something of this nature, and they find it incidentally, meaning they were looking for something else, but they found a spot on their kidney.
So with that, how important is it for early detection, or how can that potentially happen? As noted, sometimes symptoms aren't even found and aren't even detected. So where does that come into play?
So I think it's an important thing to highlight. So right now, most patients don't present with symptoms, and we have to find these tumors incidentally. And so as a researcher, this is one of the big areas that I think everyone's very excited about and everyone's very kind of organized around, is trying to identify kidney tumors early. At the Princess Margaret Hospital, there's a number of different investigators developing new assays, experimental tools, and diagnostics to try to find kidney cancers earlier. And I think this is a really important avenue for research.
Christine, for you, you were nodding the entire time as he was speaking, and of course you were part of the team that helped light up the CN Tower and to create awareness, because again, a lot of people might not have this information at their fingertips. Well, they do now with technology, but aren't out there looking for it. So from your organization's perspective, what is it that you want people to know about and to learn about?
Well, first of all, thank you so much for bringing awareness to us and on the research that's being done. We really appreciate it. Kidney Cancer Canada is here to help. We're here to help our patients, our medical professionals, the community at large. When you are diagnosed, I hope that you will reach out to us on our website, www.kidneycancercanada.ca, and we have multiple avenues that we can support. We help patients peer-to-peer. We help them find the right healthcare professional, because we also have a lot of patients in remote and rural areas that don't have access to proper care when you have kidney cancer. So it's really essential that we get them in touch with the specialists that can help them best.
Very quickly, the campaign this year is called Show Your Kidneys Some Love. Important because we were talking off camera about things that you can do for yourself just in general, kidney health, and what are some of those things?
Exactly. I'd like to bring attention to the IKCC, the International Kidney Cancer Coalition. This is their campaign that patient affiliates all around the world are joining to celebrate, to bring awareness. We really need to take care, it's our general health. A lot of times people say to us, what can I eat properly for kidney health? There really isn't. Just follow good. We use the Canadian Food Guide as an example. Drink water, exercise. If you're not into big exercise, walking is, great. Just good general care of yourself, and then find the right help when you are diagnosed.
A lot of important information here. I thank you both for coming in and shining a spotlight on what is so very important that people need to know about. So thank you to you both.
Thank you so much for having us.
Thanks very much for having us.
Yeah.